about a year and a half, we're finally seeing a little light at the end of the tunnel as far as the pandemic is concerned. We certainly have some cautious optimism about where we're at right now. Here at the Jewish home, we're having family members start visiting their loved ones. Sporting events are opening up. Fans are being able to go to these events. Next month, they plan to have children get back to school in person. So it seems to be a lot of positive things going on. But at the same time, we have some caution and some concern. And that is what we call these variants that are coming out. Now we know viruses mutate, they change. And globally, the SARS virus has mutated multiple times, different countries. The CDC keeps an eye on that, and they've actually graded these variants into three categories. One is a variant of interest, one's a variant of concern, and the other group is a variant of high consequence. Right now, the CDC has recognized two strains of the variants which they are in the group of concern. One is called the Alpha variant and one's the Delta variant. The Alpha variant was discovered in the United Kingdom at the end of 2020, and the Delta variant was discovered in India at the end of 2020. And from India, it spread to Great Britain earlier this year, and the Delta variant started spreading in the United States. And about a month or two ago, they realized that about 20% of the strains of the coronavirus right now in the United States are the Delta variant. The World Health Organization started naming them with Greeks because they don't want to give the countries where these variants started like a stigma. So you'll see alpha, gamma, epsilon, delta variants. The CDC has taken the Delta variant and again has made it one of the variants of concern. As I said, viruses mutate, they change. The coronavirus, which means crown, has spikes on it. We call them surface spike proteins. Quite interesting because the surface spike protein is where that attaches to the human cell. As it attaches to the human cell, it does damage. If you develop the virus, or if you've gotten a vaccine, the immunity is actually caused because the antibodies attach to that spike protein. And even though the virus comes into the system, it doesn't get into our cells because it can't attach to the human cells. So that spike protein is extremely important. Both the alpha and the delta make mutations or changes to that spike protein. That's why it's of concern. Now, what does that mean clinically? Well, through reports from India and Great Britain, we know that the Delta variant acts differently. And certain things how it acts differently. One, it's more contagious. If you developed the coronavirus before, the chance of spreading it to somebody else is around 2.5%. So if a person gets it, there's 2.5 patients that or 2.5 individuals that they would spread it to. The Delta variant, as it's being more contagious, for every person that gets it, it spreads to 4 people. So we know that it's more contagious. It could be a quote a super spreader. Also, the symptoms that it gives are different. Common coronavirus symptoms are a cough, loss of taste, loss of smell. The variant seems to have other symptoms. Headache, sore throat, runny nose, and it seems to attack younger people more prominently than the coronavirus. So, like I said, it changes the surface spike protein. If you're vaccinated, you do have the immunity because that's how the vaccine works. The three groups, Pfizer, Moderna, and Johnson & Johnson, have tested their vaccines against the Delta variant. And all three of them, although they're not peer-reviewed studies, but all three of them state that their vaccines are effective against the Delta variant, which underscores the importance of getting vaccinated again. Pfizer right now is actually considering a booster to see if the Delta variant changes or if it becomes even more, they're called like a super Delta variant, if their vaccine covers that as well. So there are studies ongoing right now. We know in the United States, less than 50%, almost 50% of Americans are vaccinated, but there's certain areas that are not vaccinated as well. In the southern states and the Appalachian states, Arkansas, Alabama, Mississippi, Missouri, West Virginia, these states, the vaccination rates are around 40%. And interestingly, it seems that the Delta variant is starting to become more prominent in these states, which again underscores the importance of being vaccinated. Besides that, they've also noted that if you're in a social environment, wearing the mask may protect against the variants as well. Here at the Jewish Home, we're trying to take a sensible but also proactive approach to the Delta variant. If you come in to see a loved one, we want everyone, when they come through the door, to wear a mask, whether you're vaccinated or not vaccinated. But when you get to the room of your loved one, if you're vaccinated, you can take the mask off. If you're the individual that you're seeing, the resident here vaccinated, and you're going different parts of the facility, they don't have to wear a mask either. But if they're not vaccinated and you want to take them to like the lobby, they should put a mask on. If you're not vaccinated, then you should wear the mask continuously while you're here at the Jewish Home. Also, as far as social distancing, again, this is another factor that we have to try to counteract the Delta variant. And we know that if you're not vaccinated, we still want to do that 6 feet. That if you're not vaccinated, see with your loved one, stay six feet away during their visit. Otherwise, I think that, again, things look positive. Hopefully next month or the month after we'll even have more news about the Delta variant. But right now, what most authorities are saying is it's more reasons to get vaccinated. If you're unclear and not been vaccinated, talk to your physician. If there's a reason why you have some concern, they'll go over the reasons why, the pluses and the minuses of being vaccinated. I hope that helps. Thank you very much.